Dear viewers, thank you and welcome to your channel, your only channel on entertainment, education, and information. The one and only Kweli Chungu TV, the one and only channel in as far as your current affairs is concerned, economical, health matters, and what have you. I am your presenter, the one and only Brother Power, Jared Wilberforce, and as usual on the controls, on the switchboard is the one and only Lady Veronica Karamu. Welcome aboard. Dear viewers, it is my pleasure once more to welcome you on this 11th day of May 2022. A wonderful evening here after some little rain and after a heavy day. We are now here to inform, entertain, and educate ourselves only on Kweli Chungu TV. Dear viewers, it is my sincere hope that you are fine wherever you're watching us from, and I want to encourage you to subscribe, view, comment, and share on our content. Always, your contributions, your partnership is what we really value and is what makes Kweli Chungu TV to be the one and only fast growing channel in town in matters of entertainment, information, and education, dear viewers. Dear viewers, today I don't really have much. I want us to relax, though it's going to be hard to relax because the content I want us to share on today is quite disturbing, and I would rather you really be keen, take care, give us your comment, tell us how you want it to be done, give us your views on if it were you, what would you do? Dear viewers, once more, we may try in as much as possible to avoid talking, but some situations really cannot are not just easily left out of everyday talk, dear viewers. Dear viewers, once more today we are setting our torch on health matters in Nyamira County. Medication in Nyamira County has been a thorn in the flesh. Basically, since the birth of devolution in Nyamira, this is the county where you heard some years back that gates were being constructed very expensively, actually to guard a hospital with no medicine, a hospital with no equipment, dear viewers. That was a story of then and it went. This is the only county where you've heard that even casual laborers in our hospitals are not being taken care of. Dear viewers, it has come a time, it is really disturbing, and that's why Kweli Chungu TV has taken it upon itself and upon ourselves to bring it to you as we have investigated, as we have found it out to be, dear viewers. Dear viewers, we've talked about negligence in our hospitals, dispensaries, and even health centers in as far as Nyamira County is concerned. It all began as a small matter in as far as assessment of persons with disabilities is concerned, then up to the wards, then to maternity services. Today, dear viewers, again, I'm seated here really flabbergasted and disgusted over what is happening in our medical services in Nyamira County. Dear viewers, I know some of us have gone through what happened last weekend into this new week on Monday and Tuesday from a level 4 hospital in a ward called Gesima in Getutu Masaba constituency. The Gesima level 4 hospital, dear viewers, on Sunday was responsible for the loss of 3 lives. A mother and 2 infants died just out of negligence, dear viewers. The family of one Judy is now mourning their daughter and her infant who passed on after alleged negligence from the medical attendants in the facility. It is alleged that the lady Judy had gone for her delivery and she was to deliver through CS, and while she was on medication, she somehow shook, and as she shook, she fell off the bed and no one was there to attend to her. It has been found that even the blood spills were still in the ward down to Monday morning after the incident happened on Sunday, costing her life and her infant, dear viewers. Same day, another infant also passed away through the same problem. Dear viewers, when we spoke about Nyamira level 5 last year, we were called names and we were told we were being sponsored by some politicians to really to really paint the picture of the county government and the county governor in a bad way. Dear viewers, I have tried to keep off the politics of the county government, but then service delivery, I can't keep off. We can't keep off, dear viewers. The incidents of Gesima Level 4 Hostel has sent Kwelichungu TV experts to the ground to try and establish what is the cause of negligence in our hostels. What is the cause of negligence in our dispensaries, dear viewers? And these are some of our findings, dear viewers. The nurses, the doctors, the clinical officers, and every other person in our hostels are suffering negligence themselves. They have been neglected by the county government. They are demotivated. Last year, we were blaming the health workers. But dear viewers, look at these scenarios. It is in Nyamira where we have laborers serving for a wage of as low as 5,000 shillings, for example, in a dispensary called Kerobo, and for several years now, their dues have not been paid. Imagine, dear viewers, if there was a nurse whose salary delays, she is working in an arid area like Nyamusi, Kerobo, Ogango, and other places in the remotes of Nyamira County. These people depend on a basic salary of less than 16,000 per month with a stalled house allowance, with a stalled commuter allowance. Today, people have worked for over 7 years, 8 years, no promotions. What do you expect of a nurse, of a doctor in Nyamira Level 5 who has to find other ways of coming to work? In this rainy season, dear viewers, what do you expect of a nurse, of a doctor, of a clinical officer at Gesima Level 4 who is living in Nyamira Town, who is living in Kisi Town, who is living even in Keroka Town? Some could even be living in Sotik. Some of them operate to as far as from Ikonge in North Mugirango constituency. Their salaries delay, they are not promoted, they are not motivated in any way, dear viewers. What do you really expect? This anger could be the one poured on the innocent patients of the county of Nyamira. Dear viewers, Kwelichungu TV has gone down to try and find out the problem. Today, we have talked to several health workers in the county government of Nyamira. They could be nurses, they could be doctors, they could be clinical officers, they could be anybody. They are disgusted, they are flabbergasted, they are exasperated because even the promotions that are said to be going on in the county government of Nyamira, since the coming in of one Amos Nyaribo, and I'm sorry if I may be hitting him hard, I know his supporters will feel what they would not want to feel. The point is, promotions are given selectively. Those who may be singing their song will be promoted. If this is happening to our health workers, what do you expect, dear viewers? If this is happening to the senior support staff and the support staffs, what do you really expect, dear viewers? Dear viewers, Nyamira County is a den of death, and I don't regret. As Kwelichungu TV, we have said it because we are victims of the negligence in our hospitals, dear viewers. Why do you think a qualified doctor, a qualified nurse would diagnose a patient and tell them to come after 2 weeks when they know this patient is supposed to deliver this evening? Simply, and this is my thinking, it is because this person doing the work feels neglected, it is late, they are supposed to go home, they have school fees to clear, they have house rents to clear, they have to find their ways to commute home with the hard times, dear viewers. The Kwelichungu TV is a personal victim of the negligence in the Nyamira County several hostels, dear viewers. It is recently when Kwelichungu TV witnessed a file missing in a level 5 hospital with full scaps where you are supposed to have your details written in the name of a file. Dear viewers, it is in Nyamira and in the county government of Nyamira where people will say, we have brought medicines in their large quantities. You go to hospital, even if you are being catered for by NHIF, you are being told to go and get your medicine outside because it is not there. It is in Nyamira where scalpels or surgery blades that they are called are unavailable. We went for our investigation and we realized a scalpel or a surgery blade can cost to as low as 10 shillings. Dear viewers, in Nyamira, when a patient goes to any hospital, they pay some little fees that is called, I don't know if it's called registration fees or admission fees. For example, at Nyamira level 5, they pay 100 shillings. I'm told in some other places they pay 50, others even 20, depending on the level of the hospitals. But dear viewers, you can imagine a surgery blade or a scalpel, as young men would call it, is unavailable even after you have paid your 100 shillings, an equivalent of 10 surgery blades. What do you expect of a nurse who does not have equipment? What do you expect of a doctor who is going to operate on a patient without gloves? Because even gloves are a problem. Dear viewers, we may be blaming our health workers, but I think if the foot misbehaves, it is the head. Communications starts from the head. The foot cannot kick, the hand cannot hit, the mouth cannot abuse. It has to start somewhere in the brain. And if the brain is damaged, then the whole body is damaged. Dear viewers, it is time to pray to God that even as we approach elections, something needs to be done, specifically in as far as health matters are concerned. It is in Nyamira County, dear viewers, where you can go to hospital. You have to carry your water from home, be it for drinking, be it for washing, be it for bathing, be it for anything. You can imagine, dear viewers, and I spoke last year and gave an example of Nyamira level 5, where the water tanks are just less than 100 meters away. Imagine if there is no water, there are no gloves, there are no equipment, there are nothing in the hospitals. What do you expect the nurse is going to do? These days, we even fear also being infected. Who is going to be keen to touch on somebody's fresh blood, not knowing what this person will be infected from? It can't work. We need to correct from the head downwards to the chest, to the stomach, and to the legs. Dear viewers, what happened in Gesima should be condemned, not condemning the health workers. What is happening about the casual laborers should be condemned, not about the workers, but from the head. Who is the head? I guess your guess is as good as mine. We don't really have much. To the family of the late Judy, Mama Pauline Nyakundi, I think she was Pauline Nyakundi from Gesima, receive our message of condolence from Kweli Chungu TV, and be assured that as Kweli Chungu TV, we are with you during this time of mourning. I have been your presenter, the one and only Brother Power Jared Wilberforce. On the switchboard of the control board is our sister, the one and only, the cute one, Veronica Karamu. Till next time, subscribe, share, and comment. Bye-bye.